There's a question of whether we could pick out early so-called oligometastatic recurrences and do what we call metastasis-directed therapy to those, meaning do some radiation or surgery just to selective areas of recurrent cancer. And that was tested in a trial called the STOMP trial and seemed to delay the need for systemic androgen deprivation therapy, which of course most patients hate, has a lot of toxicities, and it certainly doesn't cure the disease. So that's one way that it could be helpful. And then a second related strategy, but a little bit different school of thought, is to actually go all in and use metastasis-directed therapy plus intensified systemic therapy in an effort to really eradicate the disease at its earliest recurrence. And so we'll see which of these strategies wins out, but they're both sort of up-and-coming things being tested in trials. That's one that was published last year, which was really testing this idea of going after and trying to pick off metastases as they show up. And that trial seemed to demonstrate that you could delay the need for androgen deprivation therapy in these patients through that kind of a strategy. But that clearly needs validation in a bigger trial with a little bit more objective endpoints. And so there's two other trials being done in this area, one called the Oriole trial and another called the Medicure trial, testing bit different approaches to how to approach the early oligometastatic recurrent setting.